back at UTMC with Dr. Cathi Badik, and she is a pediatrician here and an assistant professor. And Dr. Cathi, what should parents be thinking about right now as kids are getting ready to go back to school?
Well, there's a couple big age groups that are most important, and number one, obviously, we all know about the kindergarten shots, and that's a pretty typical age group that you need to be thinking, I need some forms filled out and going to see a physical with my doctor, as well as the 7th grade area. So that's another big change that's probably happened in the last 2 years, where you're getting a little bit more specific with things that you need before to go back to school.
Okay, so what grade levels, what ages are going to need some sort of vaccination?
Well, generally at that kindergarten time frame, there is the booster shots that you're getting, and that's for diphtheria, tetanus, pertussis, polio, measles, mumps, rubella, and chickenpox.
It's a long list.
I know, it's four shots that they generally will need at that time. And obviously it can be a little concerning for parents, but that's what, you know, the pediatrician or family practitioners are there to talk to you about the reason why we do those vaccines. And the other big time is in 7th grade now, where they're double checking to make sure that you've had both your varicella vaccines, your chickenpox shots, as well as seeing that you've had a booster to tetanus. So that's the Tdap booster. So it gives you protection against whooping cough and tetanus. So it's a big, important thing that's changed in the last couple of years.
All right, very interesting. Do you find most parents are interested in getting these and are cooperative, or do you run into a lot of resistance to getting vaccines?
Well, obviously in the last few years, with many of the concerns that have come out in the media, more than anything that's been validated from science, there have been more times where we have concerns from parents, and that's what our job is, to try and make sure that we can talk to you about the issues that you may have heard about on the internet, because that's a very common place that people hear things that can be very scary, and that's what the physician is there to talk to you about, the risks and benefits, and help give you the information you need to make an informed decision for your child.
Is it difficult to get these scheduled? Do you need to give your doctor a lot of notice to make sure that they have the vaccine in their office?
Generally not the concern for the vaccine part, but definitely the scheduling. Around school time in August and September are probably one of the peak seasons for physicals in offices, so sometimes we do get backlogged with trying to get people in. So the more that you can plan ahead and know that I'm going to need to get this done eventually, the better off you'll be, so that you're not scrambling to try and get your paperwork filled out and then not have your child be able to start school.
Are county health departments also an option for getting updated on your vaccines?
Absolutely. They normally, last year especially, they had some specific clinics for Tdap for the 7th grade boosters, because that was a big change that all the offices weren't necessarily prepared for as much as we could have been. And so definitely that will be something that this season they still have available. And usually any time that you had concerns or weren't sure about insurance coverage for vaccines, the health department is there, that you can always call and ask about availability.
Okay, well, thank you for those reminders.
Absolutely.
Good advice for parents. And that is tonight's Talk Back with Dr. Cathi Badik at UTMC.